Good evening, everyone. It's a pleasure to have you join us this evening for what promises to be a highly informative event. My name is Marie Ennis. I'm the Communications and Information Officer for the Migraine Association of Ireland. For those of you who may not be familiar with our work, we are Ireland's only patient charity, providing support, education, information, and reassurance to people living with migraine and other headache disorders. We're delighted to be partnering with Novartis Ireland on the new Tame Your Migraine campaign, which launched today. And the aim of the campaign is to empower and to encourage those living with migraine to tame their migraine by proactively seeking support from their doctor and pharmacist. So I'm joined this evening by RTE broadcaster Yvonne Quillen, who has lived with migraine since childhood, and GP headache specialist Dr. Sinead Byrne. And we're going to discuss taming your migraine. At the end, there'll be an opportunity for Q&A, so please feel free to drop your questions into the Facebook live stream, and we'll get to them at the end of the broadcast. So if everybody's ready to begin, let's begin. So I'm going to start, Yvonne. Yvonne, could you start by telling us when you first experienced your first migraine?
Yeah, hi everybody. Thanks for having me on, Marie and Sinead. It's lovely to meet you virtually.
Lovely to meet you virtually too, Yvonne.
Yeah.
Go hi.
I know. Yeah, so the first migraine I remember, I was about 6. I might have been 7, but I was very young because I know I was Irish dancing and I only did that when I was very small. And the first one I remember, I was at a feis, so it would have been in a pub. So it was, smoky, loads of people, loads of noise. And I just said to my parents I had a pain in my eyebrow. And that was the only way as a 6-year-old I could really describe it. But I can still feel like, what it felt like. I was really confused by it because I knew it wasn't a normal headache. I just felt a bit dizzy. And I obviously didn't know what it was. I didn't know that I needed to get out of there. So I didn't. And the day went on and I ended up vomiting and it was just really bad. And I can still remember that very first one. And there's a lot of things I remember about when I was 6, but I remember that. And that's just that was just typical of my migraines then when I was small. It was just, the head, and then I would vomit because I wouldn't have any, there was nothing that I was aware of that would be, preventative or an intervention. That was my early experience of migraine. And that would have gone on all the way through my teens. I didn't know anything about any medication.
Okay, so at that time, from a young child to your teenage years, was the frequency of migraines the same? Did they change as you got older?
They weren't very frequent as a young child. They definitely got more frequent when I hit puberty. So I suppose hormonally it probably made a difference. I do remember struggling a lot in secondary school, and I suppose stress probably that would have contributed to the frequency of them as well. So obviously hormones and stress. I did some food allergy testing and things like that, in my teenage years as well. And I'd already known that I was intolerant to dairy because when I was very small, I had a lot of eczema. So it would have been on goat's milk and stuff. And obviously that came up again, and things like wine, if I had a glass of wine, within a half an hour, I'd have a migraine. So there are certain triggers that I was aware of, around that time. But lots of them I wasn't aware of as well. So when I was a teenager, it would have been fairly regular that I would have been coming home from the nightclub, as everyone else was going in, because I just couldn't handle it. I would have had to go home and lie down, and that would have been fairly regular. On the rare occasion, I would have not gone into school, but I'd say it was very rare because I would rarely wake up with a migraine. If I wake up with a migraine, I know I'm in serious bother, and I'm sure anyone on the call that experiences migraine knows all too well. If you wake up at one, you're in serious bother because you've just slept. So for me, I feel like if I've slept, surely that should have helped anything that was developing. So I wouldn't have rang in sick to school that much. I might have developed one during the day or the evening and had to lie down. Yeah.
Sinead, is that common, that migraine in children and it being underdiagnosed and people not really knowing what it is, and how Yvonne described her symptoms as a child? Is that common?
Yeah, I think it's really common. Yvonne described it so well. And in fact, strangely enough, it's, the boys even end up there's more presentation of boys, pre puberty, they'll get headaches migraines slightly more commonly than girls, but it's very underdiagnosed. I mean, and I think it goes back to training, and that I'm thinking of when I was in medical school. I mean, there was absolutely no teaching on migraine whatsoever. There was actually no teaching even on headache. Neurology was always really interesting, but there was just so much to cover, and that was one aspect that I found in my training was very little understood. So that was the baseline where I was coming from. And then as a GP as well, like you just wouldn't even think of it. Like, a tummy pain in a child, it wasn't something even when I did a diploma in child health, I did pediatrics, wasn't on the radar at all, which is really disappointing, I'm sure, to hear. But I think it's really improved that the knowledge now that the people, and thanks to awareness campaigns like this, that it makes people realize, and once as a GP, when you have a patient with migraine who's really suffering and they're coming in and tell you how disabled they are and how frequent the headaches are, GPs they want to help their patients, so often sometimes a patient like that will make you up your ante and actually learn a little bit more. And then I ended up getting into headaches in a big way because I'm one of the GP leads in St. Vincent's Hospital, and now I just find it the most rewarding part of my work is treating migraine, because it's so rewarding to kind of be able to kind of give somebody their life back a bit, because it can really, as Yvonne said, dominate. And I think there's a lot of fear as well in migraine, and understandably, as Yvonne mentioned, when you wake up and it's like the migraine is already ahead of you, and that's dictated how your day goes. Your day is a write-off. And that's there's a fear, like how will tomorrow be, and you're getting married maybe, and you're wondering on that one day, that really important day, are you going to have a migraine on the day you're getting married, maybe, and then you're doing maybe your leaving cert and you're worried, am I going to have a migraine, when I'm sitting that first paper? Because of course, as Yvonne mentioned as well, stress is the big trigger. But I have to say, I think it's brilliant now that there's so much education now for GPs, and the ICGP have put a lot of time into, and I think now more and more I see that actually GPs they're very interested in helping, and they have a really good reference guideline, and the more talks that are done, the better, because the learning never ends. And sure, even as a doctor working in headache and migraine, the learning never ends. I was at a conference there last year at the International Headache Congress, and it was so fascinating, all the world experts, and there's still some unanswered questions. Not every question we can answer, but it is probably the best time ever to have migraine now, is what I would say, because there's so many things out there to help. So don't be disheartened, and do talk to your doctor.
That's a good message of hope, Yvonne. Or Sinead. Yvonne, was it a GP? When were you diagnosed officially with migraine? What age or what circumstance do you remember that you got that diagnosis of migraine?
I can't really remember. I'm not sure I would have taken it in. I probably would have just been told when I got home, so this is what the doctor said. And so I don't remember ever knowing, but I knew there were migraines, in my teenage years. I knew that's what they were. And I guess, like Sinead said there, like, I don't remember there being a huge amount available from the GP. I don't remember the awareness being there about symptoms and treating them. And I think there was a bit of an awareness around triggers, because I knew to stay away from certain things. But then again, the triggers for everybody is just so personal. And yeah, like I said, I don't think there was much information there on how to treat them, particularly in children, because you're not going to give children the type of heavy meds you're going to give an adult. I just kind of decided, right, this is my lot. I just have to cope with this. And I just put the head down, and quite literally put the head down if I got sick, and just started dealing with it. And if I got a migraine, I just had to, exit from my life for that day or for that weekend or whatever. I felt a bit lost before that. I didn't really know how to deal with it very well. So yeah.
Okay. And do you think you talked about when your cousins came to stay and you had to go up to your room, do you feel like that you were a child then, but do you feel even on that 20-year period from being a child growing up to when you started to get more control over your migraine, do you feel that your family and friends do understand that impact, that sometimes you do have to withdraw from events? Do you feel that they understand, or are they saying, oh, there's Yvonne again, gone to her room?
No. They do, in fairness. My family do, and my very close friends growing up did. bed. They would have minded me. They would have put me in a taxi, or they would have brought me home if they had to bring me home. And my close family members do. I have 2 small kids, and they get it. Like, they know if I'm upstairs in the room, I'm in a dark room, that that's just, I have to do it. And I think, you know, people mean well as well. People who don't understand it, they still mean well. My husband says to me, like, if I'm in the bed and I'm lying down in the dark, he's like, is there anything I can do? Like, is there anything I can do? And I'll just say, no, it's not. So at least then, like, you know, it's not that somebody is trying to fix it, because I know they can't fix it. And I actually find that really reassuring for someone to say, is there anything I can do? Because then you can just say, no, there isn't. Thank you. Or yes, there is, a glass of water, and close the door. But I mean, for the most part, people don't understand it. I mean, I don't know what Sinead thinks, but I don't know how you would understand it if you haven't lived it.
No.
Did you want to come in on that, Sinead?
No, yeah, I think Yvonne is completely right. I totally agree. And I think if you don't have a family member who suffers from it, or, you know, if you don't have a close friend, like Yvonne mentioned, sure, how could you understand it? It doesn't even mean people don't get it at all. You have to know somebody close to you to understand it, or suffer from it yourself. And I think as well, the thing is, you know, it's not like you can do a blood test and go, all right, that person has migraine and somebody else has migraine. No, you can't. You know, if you do a brain scan, majority of times it's normal, not always. Sometimes you actually see little white lesions in the brain, because they're evidence of the little attacks, the migraine attacks that are going on, because we know it's a vascular process. So yeah, you couldn't have any understanding, and I'm sure it would drive Yvonne mad, and any migraine sufferer, when they hear somebody saying, oh yeah, sure, that's just a headache or whatever. Like, you have no idea. You mightn't even have a headache with migraine. You could just have aura, you know. So it's just, I think there is you know, if someone doesn't suffer from it, doesn't know someone close, you know, they just don't get it.
So Yvonne, you were saying, I mean, it sounds like you have very understanding family and friends, which is wonderful. What about the work situation? And obviously, you know, you're in the public eye. So has it ever impacted your work in some way?
Oh yeah, it impacts it all the time. Like, that's an ongoing thing, and it's just something I have to live with. Like, you know, your migraines, or the blood vessels in your brain, don't know that today is the day that you're off, or today is the day that you're getting married, or today is the day that, you know, you've got this job you've been dying to do. So yeah, I've had to ring in sick. I don't ring in sick, like, unless I have a migraine, and rarely actually would I wake up with one. So, you know, if I wake up with one, I know that this is just a write-off of a day, like Sinead described it perfectly. So yeah, it's happened loads of times, frequently. When I'm already in the office and I feel one coming on, that's tricky, because I just feel like a nuisance. Because if I say to my colleagues, oh, I have a migraine, you know, I have to go home, like, you just feel like you're cheating or something. But I have to read an auto cue in a studio with lights and look at a screen, like preparing the scripts all day and editing, moving images on a screen. So it's just not feasible during an attack. I have gone down to the bowels of RTE and found a dressing room and locked the door. And, you know, I've laid down for a few hours to try and lift my migraine. Doesn't always work. In fact, it rarely works unless I have something else with me. But like, yes is the answer. I spent a lot of years begging RT producers to let me present the GAA on the television. I eventually got to do the club championships there a couple of years ago, started doing that. And I'd say about 3 weeks in, I woke up with a really bad migraine, and I was devastated that I had to ring in sick, because I actually love my job. So I don't want to have to do that. I was actually quite worried about the Olympics as well. I was really worried about Tokyo and the humidity and the heat.
Okay. Yeah. And then that's a stressful situation to be in. So then stress exacerbates the migraine, I'm assuming. So it's like this vicious circle that you find yourself in.
Yeah, stress doesn't help. And I just feel I don't like saying no, or I find it hard to say no, or I find it hard to let people down. And I hate having to say I have to go home. Like I could probably count on one hand the amount of times I've done it in 17 years in there, because I just do not want to have to do it. So I'll probably suffer on through and say nothing, because there's no point saying it, because nobody has the answer. So there's absolutely no point saying it. And then you just become a bit of a, like, that's just not a way to live either, you know. But yeah, that, and then you're stressed and you're anxious that the fact that you've let people down, or the fact that you've, you know, put your own health behind other people's needs. Oh, it's just crazy. Like, you're just battling with yourself all the time. Do I suffer on and say nothing, or do I just go home and do the right thing? And more often than not, unfortunately, if I'm in work, I probably do suffer on a bit in there.
And as Sinead said, though, at the start, Yvonne, thank you for being so open and honest, because it's only by talking about these things and by acknowledging them and by speaking about them in public that we can start to break down that taboo around, you know, I'm not well enough to go on, or I'm not well enough to do this piece of work. Sinead, does what Yvonne says sound familiar to you when you have patients coming to you in the clinic? They're not just talking about their migraines, I presume they're also talking about the stress of how this impacts their life?
No, absolutely. Gosh, I think Yvonne she's just epitomized an absolute warrior, doesn't she? She's unbelievable.
Yes.
She's a force to be reckoned with. I mean, talk about determination, you know, like, because it's, like, we know it's one of the leading causes of disability, and there she is presenting on telly and lights and auto cue and whatever, like, unbelievable. But I mean, that gives people a lot of hope when you see how high achieving these migraine sufferers are. You know, like the patients that I meet, like, you know, they might just have episodic migraine. They might have kind of end up kind of going into sort of daily headaches just because of a stressful situation or that. But they're often really high achieving people, like Yvonne, and a lot of them are very proactive, and they fairly kind of take control of things. And what I would say is the Migraine Association of Ireland, I have to say, is a godsend. It's a godsend for me. It's a godsend for my patients. I'm always ringing them up, looking for the latest handouts, leaflets. Like, you just, for anyone listening, the Migraine Association of Ireland will put you right. They put you in the right direction, essentially like specialist. You know, and for me, it's just a really trusted source. Like, you know, you'd give the International Headache Classification a run for its money in the amount of, like, information you have on the screen. So it is like a very trusted.
Thank you, Sinead.
One of the best organisations I've ever seen, I have to say. But anyway, so we love you, and thanks for all your leaflets and everything for
my goodness. Well, we'll just stop everything here right now, Yvonne. And
you know, isn't it great to have an organisation like that are so passionate about the members? Like, I haven't seen that level of passion in any other, you know, ailment.
My goodness. Thank you, Sinead. We appreciate that very much. Thank you.
It's true, absolutely. But yeah, so what I would say is, you know, regularity is your friend. And like, you know, in Yvonne's situation, she's presenting, she's doing all these different things. So sometimes when you know you're going to have a very irregular kind of week, you've got to watch the other things. Then you've got to make sure that your blood sugars are okay, you know. So there's little tricks like that. You kind of know this is a stressful week. Got to make sure every potential trigger is, you know, watched, that I'm kind of, you know, planning for it, and that when the stress is over, that you don't completely relax and have a big sleep in, or then you're kind of, you can almost guarantee what might happen then. So it's possible to take control even by watching lifestyle. That's what I would say.
Does that resonate with you, Yvonne? Do you put things in place? Do you track your symptoms? Do you track your triggers? Do you keep a diary? Do you?
Yeah, I did that last year, actually, because I was just trying to get to the bottom of it. I went to my GP probably towards the end of, it was before the pandemic, but it wasn't long before it, because I ended up getting into St. Vincent's to see a neurologist during the first, or after the first lockdown, I think. I just know I was wearing a mask. And then I had some scans done, and thankfully the MRIs and all of that came back normal. But in the lead up to all of that, I was tracking my migraines so that I have as much information as I could for the neurologist. And I mean, I know myself, if I have a busy week coming up, I do that. It's funny, I was nodding away there going, yeah, I do that, because I know, like, if I have, you know, 6 out of 7 days that are really, really full schedule, not just with work, but particularly now, the kids aren't going anywhere. So they don't have school or football or piano, or they've nothing. So they're here all the time, and you can't just leave them in a room with a television. Like, they have to have a structure. So days like today, where, you know, I'm doing these kind of things, but they have their calls, and, you know, they have their school bits to do, and, like, you know, my husband's working, he just finished work for the day. So those things, normal daily life is stressful. Like, it's not just about your job. It's about, at the moment, you're juggling way more than you're normally juggling because there's more people in the house for more hours of the day. They need your laptop at times, and they need your attention at other times, and they need fresh air at other times, and you have to build that in. And I was looking at this week last night. I was looking at this week going, right, this is a really busy week for me, because I have a really busy week just in a normal work life, busy week. And today has been really busy. And obviously the kids aren't going to school. So there's a lot happening this week. And I did think about that. And I took my vitamins this morning. I drank loads of water yesterday. I went for a run yesterday, you know, to get my head right, keep myself ticking over. And I would have had in the back of my mind a little bit of doubt about whether I'd have a migraine by this time today, just because I've been doing this kind of stuff, you know, calls and you know, the TV thing and the few bits that you're doing during the day, the radio, you're up to high dough. Like, so I find if I'm up to high dough, I really have to take some deep breaths, because that's just my personality. I get a bit overwhelmed and I have to really try and kind of find a bit of zen. But I find that very hard. Like, I'm not very good at switching off at all. And I know that about myself. And I know I get migraines when I don't do that. So yes is the answer. I do track, and I did take a diary, and yeah, things like food as well. I was very aware that sugar was bad. Things like that. I figured that out as well.
Well, I think this is very useful. So, Ivan, you're saying this is what I do. I drink more water. I'm taking my vitamins. I'm breathing. I'm going for my run. And Sinead is saying the same things. You're saying, Sinead, that when you know that this a particularly stressful time is coming up, that you need to have these things in place. Yeah. Do you are you finding, Sinead, that have you noticed any change in your patients since the beginning? I was going to say the beginning of the pandemic. My goodness, like we're coming almost to a year of living like this. Have you noticed any change in the past 9 months?
So look, there's been good and there's been bad, funny enough, because not everyone like Ivan is a superstar TV sports presenter. other people have maybe kind of, you know, more sort of with a computer kind of job, maybe at home, working from home. I guess the majority of people probably can manage working from home, and actually that has been a really good thing for many of the migraine patients I've met in the hospital and also in the clinic that I set up. But they actually find that I would say majority it is actually suited, that they can kind of work at their own pace, that if they're not feeling maybe 100%, that they can kind of just do the things to mitigate it, that they're not sitting in the office with everybody looking at them, you know, going, I need to lie down now, I just need to take a break, and being aware of that and the pressure of that. So there's quite a percentage of patients that the lockdown, strangely enough, has suited. Now, of course, as Ivan mentioned, it depends on your family situation. And the downside, I would say, is that not all things that we do in clinics have been able to happen, and that's not been great for some people. You know, certain treatments haven't been in place, but you know, that's been disappointing.
Have you been able to see, have you been mostly having telephone calls with your patients, Sinead, or have you been able to see them face to face, or?
So from back in March, we kind of quickly went to virtual consults where we weren't seeing new patients, but we were kind of getting through virtual consults. There was quite a few of those that, you know, funny, you can kind of manage that quite well for headache, but I think it's so important on a first visit to a doctor, if you have a headache problem, that you're there in person. So we went back to seeing people and doing all the treatments again, and now last week a little bit of virtual going on again. So yeah.
Okay, good. Because one of the questions I was going to ask was, it's obviously it's incredibly challenging for GPs and hospital consultants to, as you said, to diagnose or to treat medical conditions, particularly if it's the first presentation. But you are encouraging patients not to let that put them off contacting their GP if they may be a bit, you know, worried about going in to see a GP, but you would advise them to please still go ahead and to call their GP and have a discussion.
Yeah, and I think that's so important to call the GP. Absolutely. Yeah, really important. You can do a lot over the phone. Yeah.
Okay. Have you found what Sinead is saying there, Ivan, about for some people that actual working from home has been a bit of a boon for people that are living with migraine? Have you found it less stressful or more stressful to be working from home? But you've got the kids around, so it probably depends on your circumstances as well, though.
Yeah, it does. Yeah, I mean, the kids are grand. Like, I wouldn't describe them as triggers for migraine. Being a bit of a bother if I did. No, I mean, the first lockdown, right, was a little bit different for me because sport was cancelled, and the sports bulletin was cancelled. So I didn't physically have to go into the office. I was able to work from home. A lot of the stuff that was coming out was, this is cancelled, that's cancelled. So I was reporting for about 2 months on cancellations. And I was able to do that from home because I didn't have to physically be in the studio. And during that time, my migraines, like, it did make a difference. I was feeling great because I wasn't driving in, I wasn't in an office, I wasn't dropping them to school, rushing, getting into the office, doing my bits or whatever it was, figuring out who's bringing them to gymnastics, who's collecting them, can I get a dinner into the slow cooker before I go to, like, all of that was like, we were all living in a rat race, and I don't think we realized it until we stopped. And then we stopped and I didn't have to go to work. Yes, we were home and we were working and the kids were here. And the schools were closed, but the weather was okay. So they were outside and, we were outside. And I did notice my headaches weren't as bad because I wasn't stressed about every day. Like, that feeling of being overwhelmed, that definitely triggers me. It affects me. And I wasn't feeling overwhelmed, even though obviously we're in a pandemic, but I wasn't feeling overwhelmed by personal circumstances. And I wasn't feeling like I had too many balls in the air. I have too many balls in the air most of the time. I'm just really good at, like, figuring out how to juggle them. But I just didn't feel like I had to juggle as much when the world came to a stop. So yes, I probably noticed that they reduced in that time. All right.
Okay. And did you find, Sinead, that that's common among the patients that you were seeing, or you were kind of saying that being at home had taken a little bit of the stress off? Sinead, did you want to say more on that, or I think you have a little presentation. If I'm going to see if I'm not too technically challenged, I can bring it up. Did you want to say more, Sinead? Sorry, go on ahead.
No, not at all. Yeah, it is interesting. Sometimes you think lockdown has had very strange. I mean, isn't it so strange that we're all still here almost a year later? It's hard to believe, really, isn't it? I mean, but we're getting there.
I hope we're not still saying this, this time next year, Sinead.
On the upside, the days are getting brighter.
Yes, they are.
And like, it's February now, like it's the start of spring, there's hope. And I think that's probably a great time to do the Tame Your Migraine campaign. It's like just at the start of spring where you kind of go, do you know what? There's actually a lot of positive things. And actually, I kind of feel very passionately about that people with migraine can take control. It doesn't have to control you. If you feel like things are, and particularly I'd say, medication overuse and that kind of thing, when people kind of end up, just to survive and get through their day, they end up maybe taking acute medication, and that can give this daily headache. It can we meet a lot of people in the clinic that have done that for years, and that's tough then to break that cycle. So just to kind of, I would direct anyone to the Migraine Association of Ireland and have a good read and look at the information, and you just would learn so much and you feel much more in control, and start keeping that headache diary is essential. And then you start to think, you know what, this is not controlling me. I'm actually seeing what's going on. You get the sense of calm when you understand what's going on and understand your triggers, that you don't have to be dictated to by migraine,
Okay, super. Thank you, Sinead. Sinead, do you want me to bring up your presentation now? Or you still want to go ahead with the presentation? Yeah. Now, this could be stressful for me to see if I can get all the times we've been doing. No, it's okay. All the times that we have been doing. That we've been doing all of this. So the
I find it horrific and stressful. I mean, I'm starting to get sometimes like pain around the eyebrow, and it probably is like the start of something. Oh, brilliant. Okay.
Okay. So you will probably need to tell me it's a PDF. So, okay. So we're going to look it's going to look like amateur hour here, Sinead, but we'll do our best. We'll do our best. Okay. So you can just tell me to scroll down. So I'm just scrolling.
Because I literally, it's 10 minutes that I'm
yes, super. No, this is great. Thank you, Sinead.
Even 10 minutes. We're going to fly through it.
Okay.
Some disclaimers there. Brilliant.
Okay.
So, that's great. And we can move on then to our first slide, which is, yeah, the migraine stats. So this is the thing. Migraine is the most common disorder, headache disorder in the world. It is so incredibly common. And I suppose probably a lot of people, you know, everyone knows somebody who has migraine, who suffers with migraine, either a friend, we all know somebody who suffers from it. It's the second highest cause of disability worldwide. So, I mean, yeah, it is so disabling. And, you know, a person can look perfectly well, perfectly healthy, and yet they could be fine, you know, one day and the next day they're in bed and they're potentially vomiting, dark room. So you can't function, you can't concentrate. And then look at the stats there, 600 to 700,000 people in the Republic of Ireland. So for anyone suffering with migraine, you are not alone. It is, you know, there is a lot of support and there, you know, it's very, very common. And us, you know, anyone who's listening, women particularly, you know, once those hormones kick in, you know, we start kind of, we're in the lead for migraine, even though the men get it too. So it might move on then to the next slide. Yeah, to scroll. So yeah, this is the big question. Is it migraine? I mean, for a doctor, I always think, is it migraine as well? It's just so often the headaches we see, by the time I see them in the hospital in St. Vincent's, or if I see them in the headache clinic, it actually, we diagnose migraine so frequently. Obviously, we always have to exclude other things. You know, when somebody worries often, if they have a headache and they've never had a headache before, we have to make sure it's not anything else other than what we call a primary headache. So, you know, in the world of headaches, we've got migraine, tension, and then we've got what we call the tax, or like the cluster headache, the neuralgias. And to kind of just, it's almost like sorting. When somebody comes in and they're saying, look, I've headaches every day, you kind of just want to sort and look at all the features associated with it. But what I can tell you is, like, nearly over 90% of the time it ends up being migraine. You know, like things like sinusitis, that somebody thinks they had sinus problems and this has been treated for years, and with the sinus problems they thought they were getting headaches. And again, so often it ends up, when you actually look at all the diagnostic criteria, it was actually migraine all along. And so a lot of things, you know, a lot of things are migraine really that have never been diagnosed. So it's underdiagnosed hugely, is the other thing. So if you don't mind scrolling on, Marie. So this is like the diagnostic criteria. So I suppose, what do I think, you know, when I see somebody, the thing about migraine is that you need to have repeated attacks. So the first time somebody comes with an extremely disabling headache and it's out of the blue, you know, if there's no family history of migraine or that, you kind of, it's usually the time where you end up getting sent for a scan, just to make sure that, you know, a first presentation. Now, sometimes it's classic, it's just so classic, but so, you know, a very severe headache and you mightn't have all the other features of migraine. First presentation, you're going to say, sometimes it seems so like migraine that it's probable migraine, but you actually need to have repeated attacks. And they last from 4 to 72 hours typically. Now, I have met people that have literally, you know, have a very extended period that they might have a migraine actually lasting 7 days. Like literally they have it 7 days. So up to 3 days isn't always the case. The thing is, when I examine someone that suffers with migraine, invariably their exam is normal. You don't find anything neurologically kind of wrong on physical exam. The bloods are normal, and usually the MRI brain is normal. And then you need to have, as we said, no other reasonable cause for it. And these are the other features that you need to be aware of. The pain is often on one side, this unilateral pain where it's like it's mostly the right side or it's mostly the left side of the head, but the pain can actually be anywhere. And the classic sort of description, so when you ask someone to describe the headache, if they're saying it's throbbing, pounding, sort of pulsating, those kind of words are absolutely typical for the pain experienced by migraine. And then a very classic thing that really helps me diagnose it is, sometimes if I say to someone, look, when you have that headache, if I got you to run up and down the stairs, you know, would you be okay with that? And if they're saying, oh my God, no, keep the head still, you know, don't move, don't shake the head, you know, keep it as still as possible, and dark room, lie down, then you're kind of thinking, God, that is just, it's so classically a feature of migraine. And then, so you need to have two of those kind of features. And then the intensity it's a moderate to severe intensity, and actually the severity can really vary in migraine. It can be like a 6 out of 10, but there are people with migraine that get such horrific attacks they'll say it's 10 out of 10. Now there's some other headaches like what we cluster headache, and it's kind of called a suicide headache because it is absolutely 10 out of 10. But the severity in migraine attacks can vary depending on the individual and the particular attack as well. And then the other classic thing is, as Yvonne mentioned, nausea, vomiting. Now you need one of that list of things. So you're either getting nausea, vomiting. A lot of people will get nausea. Not everybody vomits at every attack. Some people will say when they vomit, they get this sort of kind of relief. It's the only thing that will actually relieve them, but that mightn't be a feature for everybody. But we know that the gut is so involved in migraine that it's not surprising that there's a bit of gastric stasis, and the gut is very much involved and linked with the brain. And then obviously light sensitivity and noise sensitivity are other features, and that's where people are like, dark room, get rid of the lights, the screens, that kind of thing. Very irritating. If you don't mind moving on, Marie, thanks a million. So yeah, this is the other thing. So again, sorting a sort of a headache. I suppose, majority of people that suffer with migraine get what we call episodic migraine. And that means that they're getting less than 15 days of migraines per month. And with episodic, you can either have what we call aura or not have aura. So aura, when we talk about aura, this is typically, it's the neurological signs that you get before a headache. So that could be visual. That's a very common one, is the, flashing lights, blurred vision, distorted vision. But it can also be sensory things like pins and needles, difficulty with speech, difficulty with language and getting the words out. And it doesn't generally last longer than an hour. It's often short. It can maybe only be a couple of minutes, and it goes before the headache. And that's what the aura is. So you could be getting migraine, that really disabling headache that, with all those features that we talked about, with or without that thing. And actually some people just get aura full stop and they don't actually get a headache. And particularly men, as they get older, if they suffered with migraine later on, they'll end up sometimes losing the headache part of migraine, and then they just get an aura, which, okay, it's not painful, but it is kind of a bit unnerving. You're kind of out doing something and then suddenly your vision goes a bit sort of blurry, and maybe you're getting pins and needles. And then so chronic migraine is then when you're getting 15 or more days per month of headaches, 8 of which are severe. Now the international classification, they're looking at that. There may be a change in the diagnostic criteria for chronic migraine, but I find sometimes people move sometimes between getting episodic migraine to getting chronic. You can go through maybe a couple of months where somebody, the stress levels are very high and they're kind of chronic. We always try to get them back to episodic and get a low frequency episodic. So you can kind of have a low frequency episodic headaches, or you can kind of be getting them very frequent, because it's still extremely disabling if you're getting a lot of migraines and it's still less than 15 per month. That's an awful lot of wasted days. And so that's why it's kind of nice to sort of count the days of headaches. And that's why when you keep a headache diary, it helps the doctor you're going to kind of see where you are. It helps with the diagnosis of that. If you don't mind moving on, Marie, thanks a million. Great. So trigger factors, I mean, we could talk for ages about these, but I think we touched on a lot of them there earlier on. So stress, number one, and look, we all have stress, so it's not surprising. Stress is just, particularly at the moment, I mean, there's plenty of stress going on. Hormones, so this is when, the boys have a higher incidence of migraine until we kind of reach puberty, and then the girls are just, they way past the boys out in the incidence of migraines. So they're, because of the hormones, and what happens is you get this with every period, you kind of you get a dip in estrogen before the period is due, and that dip in estrogen, we know, is the trigger for the migraine attack. So it's kind of good to know that, kind of watch it in your kind of headache diary, because we can target that for kind of treatment. There's ways of doing that. Again, very important to say that not eating a meal is actually nearly, like, it is so important, the regularity of eating food. It's so important to have a breakfast, lunch, dinner, and 2 healthy snacks. And sometimes people will kind of think, oh, maybe it was, it was but it was a certain thing in the thing I ate that had a bad reaction and that caused a migraine. But sometimes it's actually because your blood sugar was really low, and that's what caused the migraine in the first place. So I think to be so kind of organized, you need to be very organized when you've got migraine, that you've actually got a healthy snack in your handbag, that you don't leave it go too long, 4 to 5 hours not eating. That is really kind of, it's really exposing you to a trigger, and all you need is another trigger, like a bit of stress coming in there, and then it'll tip you into the threshold of having a migraine. So just organized. I mean, we could go on for ages about weather and that kind of thing. I have patients that when they go to California, their headache is gone for them. They're in California, they come back to Ireland and they're back getting like really frequent and in fact chronic headaches, and they've had none for a month. So, weather is an incredible thing. Sleep disturbance, sure, look, it goes hand in hand with stress and all that thing. You need to go to bed at the same time every night, get up at the same time every morning, and just don't be tempted to sleep in at the weekend. Up at the same time, bed at the same time, because Saturday morning migraine is a really common thing. So look, yeah, we could go on a lot about the other things, but I think, exercise, I would say, is, for some people it can trigger a migraine too much, or excessive exercise, but exercise is so important, and particularly now, I think it's really important even for your mental health, to reduce your stress levels. So I would encourage everyone to get that optimum, find that optimum amount of exercise, whether it's going for the brisk walk. But the key thing as well is to eat an hour and a half before you go out to take exercise, and to warm it up. Don't suddenly go into a brisk run not having eaten, because again you'll think, oh god, the exercise brought on my migraine, maybe that's not good. But you actually need to prepare for the exercise, and I think it's important to do it, and often people find it a really useful way, a lifestyle measure that will help you stop an attack and prevent one. So if you don't mind moving on, Right, thanks a million. Yeah, headache diary. I mean, this is from the Migraine Association of Ireland. You can kind of check their website again, and there's a link to a good headache diary. So that's fine. And there's lots of little apps you can get on your phone as well to help. This is just, yeah, if you don't mind going to patient education, brilliant. So look, we're kind of, I know we're focusing this more on triggers and that, but like, call your GP, call your doctor. If you feel things are really troublesome, you can ask to be referred to a specialist. If they're not sure who is a good specialist or who's in your area, contact the Migraine Association of Ireland and they'll put you in the right direction. And then don't be tempted to just kind of take medications every day just to be kind of, taking whatever across the counter stuff, because if you're taking medication more than 6 days per month, you really run the risk of getting what we call medication overuse headache, and that is a big risk factor for your migraine turning into chronic migraine. And you can really feel then that you are not taming your migraine, and that you're really, it's controlling you. So just don't fall into that trap. And if you do fall into that trap, don't worry, contact your GP, get referred to a headache clinic, and we've lots of ways to help you. So if you don't mind scrolling on, yeah, pregnancy. So for pregnancy, this is where the hormones come in again. You see, when it's funny, a lot of people that don't get aura are often on things like combined oral contraceptive pills, and they find that sometimes the pill can be really helpful. You can kind of use that. But so we try to regulate hormones, and funny, pregnancy is one of those things where, because somebody's pregnant, they're not getting this constant changes of levels of hormones, and a lot of people who suffer from migraine do much better in pregnancy. So don't let the whole thought of pregnancy, if that is something that you want to plan for, don't let it scare you, because in the second and third trimester particularly, people end up usually having a great freedom from headaches. And you just need to plan for it, speak to your doctor about it. And the first trimester can be a bit dodgy between nausea and not feeling like eating, and you can see where all the potential problems kind of are. But again, lifestyle factors are really important to treat it, so regularity. And the Migraine Association of Ireland has a great source as well for kind of complementary therapies that you can use. So sorry, just on to menopause then. Excuse me. Again, this is a time where you're going to probably find more migraines because of fluctuating hormones. And once, excuse me, apologies. Once you're kind of post-menopausal, if you've suffered with episodic migraine, you don't want to wish your life away, but you're probably quite likely to be free of headaches. So don't despair. we don't want to wish ourselves to getting older, but usually things improve. So I'd be very hopeful in that regard. If you don't mind scrolling on again, I think we probably are at the end of that. I'm not sure if we've a bit of time left over, but you guide me, Marie.
Thank you so much, Sinead. Let me just get you all our lovely faces back on screen again. So we don't, I'm afraid, have time for questions. And I'm looking at the comments, and there are quite a few specific questions. I don't want anybody to feel like we are ignoring your question. You know, you can always call the information line. The information is there on our Facebook page. You can always get in touch with us if we don't have time to answer your question here. So apologies, we will not be able to get to your specific question. I did want to just grab a couple of comments here. I'm not sure if you can see it. Jane said, Ivan, amazing how you've managed so well in your career. I can't even begin to imagine what it must be like in a TV studio when an attack kicks in. Helen wanted to thank you for being so honest. I feel the same, such a pain, but yes, we're resourceful, get on with it. Michelle says Ivan hit the nail on the head with such an accurate and honest description of what it's like to live with migraine. So Ivan, once again, thank you so much for your openness and honesty. It's not always easy, particularly when you're in the public eye, to be so open and honest. But I just wanted you to know that people are incredibly grateful to you for sharing your story. So thank you so much. I'm just going to have a quick look here. Again, so sorry, we're not able to actually answer any of those specific questions. But again, I think Sinead's presentation was super as well. Let me see if I can just get Michelle's comment off the screen there. Sinead's presentation was super. It was highly informative. Please get in touch with us if you need any more information, how to get in touch with Dr. Sinead Byrne, or if you need any information from us, do not hesitate to contact us. I want to leave the final words to Ivan. So Sinead, you've been wonderful. You've given us a lot of hope. That's the one word that you've said time and time again. Don't give up hope. There are strategies for coping. There are ways to be helped with this. So thank you so much for that, Sinead. Ivan, is there anything you would like to say to those that are watching in now?
First of all, I don't want to take all the plaudits, because that presentation, Sinead, was really helpful. Thank you. And it's kind of things that you kind of forget over the years, certain things that we should be doing that we kind of stop doing and forget to do. So thank you for reminding us all that sometimes it's the basics that we need to keep an eye on. Just before we go, I just really want to say that I think it's important for people that suffer with migraine to know that they're not on their own, because I have felt over the years quite isolated, particularly kind of in the first kind of, the first 10 years I was getting migraines. I just felt like nobody understood. And that's because nobody did understand, I don't think, fully. I think there's more awareness now, but I think this campaign is important because the whole reason for it is to raise awareness and understanding of the condition, and also to empower people who are suffering with migraines. So I don't know how many people are on this call, but please just do genuinely contact the Migraine Association of Ireland and ask those specific questions. Go to your GP, and just in the back of your mind, remember me and everyone else on this call who's actually in the same boat. And sometimes that's a comfort, because you do feel quite alone when you're going through something and nobody else around you understands it. So yeah, that's all I really have to say. Just know that you're not on your own, and try and kind of take some of this empowerment now to go and, talk to somebody and do something about it, because there are things that can be done.
Thank you. Thank you so much, Ivan. Thank you so much for your time. I know it's been a really busy day for you today. We really, really appreciate you taking the time to do this. Sinead, you've always been an incredible supporter for Migraine Association of Ireland. So thank you again.
Without you, Marie, I'd be lost without
you. Thank you.
So
thank you so much.
I mean, it is the story. Like, I think that gives great comfort. You just hit the nail on the head, Ivan.
Thank you. Thank you. Thank you both so much. And I just want to say thank you as well to everybody who listened in. Often on these things, you get drop-offs, and I just see the numbers are going up and up. So we had a lot of people watching and looking in. I also want to let you know that we run many different events. They're all online. So if you look at our events page on our website, but also keep an eye on our Facebook page, you'll see that we actually have more events coming up with information about migraine, and they'll be longer than this, so you will have an opportunity for some questions and answers then as well. And of course, as I said, don't hesitate to get in touch with us. So I'm going to end this broadcast now. I'm going to say thank you so much again to Ivan and to Sinead, and I wish you all a good night.